So probably one of the biggest hurdles you'll face before you retire and before you jump over to Medicare, which is age 65, is going to be paying for your own health care. Now, if you've been employed at least long enough that you've been on a company plan and they provided you with medical benefits, you probably have no idea what it costs in premiums to jump onto your own plan. Of course, when you retire, you can always jump onto COBRA, which is the extended healthcare coverage for about 18 months. However, you will be paying for the entire premium. So if your employer was covering most, or if they were covering all of your healthcare premiums, it's still going to be a big surprise for the amount of cost it's going to be just to get the premiums covered. Now, why is this so important to plan? Again, because the cost, at least in California, is very high. So there's an easy way for you to go about estimating this, of course working with an advisor, but you can always jump onto one of the provider websites and kind of go through a mock exercise of what it would take to cover the cost of this healthcare. One of the other big factors to remember is that health insurance has changed. So if you've been employed with your employer for a really long time, you probably remember the days where insurance companies put out a pre-existing condition clause where you would have to go through a health screening, make sure that you were healthy enough to get coverage. That is no longer the case. Now they're going to purely base it on your sex and your age. So whatever that looks like, those are going to be the premiums, and they're going to base all the different options off of that. So here we are on the Blue Shield website. And again, health doesn't matter, but I put in a 62-year-old. I put the zip code, which is in Orange County. Now here are all the different levels of plans. So they typically will go off of this tiered schedule, which is bronze, silver, gold, and platinum. Platinum being the highest, meaning you're going to have a minimal amount of out-of-pocket expense, but your monthly premiums will be higher, and then vice versa. Meaning bronze plans will have a lower premium, but a higher deductible and individual out-of-pocket maximum. Again, this is for a 62-year-old person, and it looks like the minimum amount of premium that you would have to pay is $700 a month. Now, this is just your premium. This doesn't cover, again, all the other charges and plan description that they have laid out over here. So here we are. We're comparing three different plans, and obviously the level of premium is vastly different. You see bronze, silver, and platinum. Each of them are going to have different maximum out-of-pocket costs along with deductibles. So on this side, this platinum side, you are seeing that your premiums are very high. However, you will most likely not pay much else because your deductible is zero. Silver, you see it's typically somewhere in the middle in between platinum and bronze and so on and so forth. So they kind of go through the different drug levels, hospital stays, and all the different things and services that are in between those. Now, this was just one individual. What happens if we do a married couple? Well, it'll most likely double that premium. Meaning, even if we throw on another bronze plan, it'll most likely be around $1,400 a month. I went ahead and put in a spouse or a partner in at age 60. So you have a 62-year-old and an age 60-year-old, and that's virtually what ended up happening. The premiums doubled. You'll see now when I scroll down to the platinum plan, it did virtually double, at least the PPO. Now the HMO is different, of course, and all these different plans are different, but that's essentially the cost that you're looking at. So there's no real tricks or no real strategies other than that is the amount of cost that you are going to have to look at, especially paying before you hit Medicare age. Now, there is one strategy, and that would be if you don't need income, you can delay taking out income, have no taxable income, and use the exchange, get a subsidy, and qualify for paying little to no premiums because, again, of that subsidy. So that is an option for some people, but for most people, that's not necessarily going to work because at some level, you're going to have retirement accounts or you're going to be taking a pension. And it's just going to create too much income for you to qualify for the subsidy. The subsidy levels are very low for a specific reason. It's meant to cover those individuals who don't have the income to cover this level of premium. Although most of us will look at this and say, hey, a lot of us don't have that level of income to cover that premium. However, this is how it kind of rolls. So one of the biggest factors is you have to consider the cost. Even though you are set to retire and you think, hey, I can cover all of my bills, I don't need my work income because everything's rolling, healthcare can definitely bite you in the butt. It can be one of the costs that you forget about or don't think of because you think the costs are going to be minimal or what they were used to be back in the day when maybe it was $300 when you got off the company plan and were paying for your own coverage. Now, most of the providers in California are typically around the same level. They might vary in what they cover or what the premiums are, but they're most likely going to be the same cost structure because they're all kind of doing the same thing. And lastly, probably the biggest relief you will see is when you jump over onto Medicare, which is age 65, where your monthly premium comes way down. You've already paid into the Part A by working, which means you'll have to pay the Part B, which is around $170 this year, and most likely will go up a little bit. You'll pay for some supplement, and maybe you'll pay for some additional plans to tack onto that, and that will cover most, if not a lot of what you need in terms of care. So your premiums will come way down once you hit 65, along with your out-of-pocket expenses and deductibles. Essentially, it just gets a heck of a lot cheaper, almost 10 times less expensive by jumping over onto Medicare. So that's one of the big trade-offs when you're considering retiring is, can you cover the cost of healthcare prior to age 65? And if not, how do you make it work so that when you do hit age 65, you'll essentially get a nice savings because you are on Medicare at that point, paying a lot less in premiums and can use some dollars to do some other fun things. So I hope this video was helpful. I know I didn't go through a ton of information about healthcare plans, but this is one of the big things to consider prior to retiring if you're retiring before age 65. Don't let the costs stump you. However, if you don't know the cost or you don't know if your plan is still going to work, contact us. Let us know how we can help you plan out your future to ensure that you can retire and retire before age 65 if that is a big priority in your life. So give us a call, shoot us an email, let us know how we can help and serve as your financial advisors to plan for your retirement and future. As always, I hope you have a great day and enjoy the rest of your weekend. Take care.